Is that how you pronounce it? Hey! We're here. See, we're not shutting down Brian General overtime during the coronavirus. Why? Because at least at this point, we're still meeting the government requirements.
It's going to be a long time. We're going to be hanging together.
Although dealing with her is like dealing with 10 people in a room at a time.
And that's what my kids say.
I mean, like 12 people. Technically, it's just the three of us. Kelly's here as well.
Just the three of us. We can make it if we try. Just the three. Oh my gosh. Remember? No? Okay.
I do remember. It's Bill Withers. You don't even know who did that one. I just don't normally hear you singing.
Wasn't it Will Smith? No? Just the two of us.
Will Smith did a remake called Just the Two of Us.
That's the one that counts.
It was a remake of Bill Withers. Don't say that about Bill Withers.
I don't even know who Bill Withers is.
Your husband is going to be ashamed of this.
Who is Bill Withers? Let's look him up.
She doesn't forgive her. She doesn't know what she's doing.
Bill Withers.
Len, forgive her. She doesn't know what she's... I guarantee...
Oh my gosh. Cool.
You didn't know. Oh. I'm sorry. So, something came up in overtime yesterday that turned into a whole segment this morning that we want to talk about with you today because it also affected our lives here. And if my mom's here, she can confirm this. I don't know if she's here yet.
She's about to be on. So you better straighten up.
So, Janelle found these articles after we conferred with our good friend Sarah, who joins us on overtime from Ecuador. Did you hear that? Ecuador.
Hey, hand sanitizer.
Ecuador. Oh, yeah.
You got issues.
Hold on. Happy birthday. Wait, that's washing your hands? Our Father who art in heaven, hallowed be thy name.
Oh my gosh.
Thy kingdom come, thy will be done.
Wow.
So, I think the best way to start this then is how millennials are talking to their boomer relatives about the coronavirus. Here's 3 scenarios that connect deeply to Janelle and my life, and maybe you can help with us too, because we're trying to figure out how to convince older Americans to take this whole thing seriously. So here we go. Anita.
Didi Tanks.
Didi is here?
And Pastor Tanks. Okay,
whoa.
So yeah. So you better watch
out. No
out.
kissing during overtime, you two. So Anita's 72-year-old mom is immunocompromised, but she volunteers regularly at a hospital. That means she's both more likely to come into contact with coronavirus, and if she does, more likely to suffer from severe case of the disease. But despite her daughter's pleas, she refuses to stop. She doesn't want to be inconvenienced or change her life, Anita said. But she wants the older folks she knows to be careful. And I'm like, Mom, that's you!
Aww.
Jessica, her stepfather, is 65. He has multiple sclerosis and recently underwent lung cancer surgery. His job as a truck driver takes him all along the I-5 corridor on the West Coast, including through the Seattle area. His company hasn't made any advisories, hasn't changed anything, and he's laughed off attempts to encourage him to stock up on his medications. Or even just got some hand sanitizer in his truck. He just says, fine. He says, I'm fine, Jessica. And then makes bad jokes like, the safest thing is just not to breathe, ha ha ha. She keeps texting him with updates and easy to understand articles, but thus far, it's been of little use. I don't know what else to do, she says. Nicole's grandmother's in her 90s and has been in poor health for some time. The family expects her to die within the next few weeks and has begun planning the funeral service. So Nicole says, we've got a huge family with all of her siblings over 80 and most of her kids, my aunts and uncles, over 60. And I've been trying to gently suggest we don't have a big funeral and have people fly in from around the country. But nope, they insist that we do this. The older family members want to do the right way. And the general attitude is that we're making a big deal out of nothing when it comes to this, and that we deal with the flu every year. And now, Janelle, you go first. You had the same problem.
I had to call.
We could add Janelle's name on this list.
I had to call Len's parents and have a serious conversation. I tried on Friday, but Monday I was like, okay, we got no choice. Yesterday, I told Len, can we call your parents on conference call? And together we were checking on them and gently said, we love y'all, but you have to pay attention. You have to stay home. It's not even about you. You can get your friends sick, which it is about them, but it's like more than them. And so they listened. And my mom is in Dominican Republic, and my siblings and I were talking, and we were like, why is she still in DR? We need to buy her a ticket, and she's coming back. So we called her and was like, Mom, you got to come back. And she listened too. So this week was kind of easier. But we're seeing that more and more. We got a lot of texts of people saying, I wasn't paying attention before, but now I'm taking it more seriously.
Yeah.
Did you notice that this morning?
Yeah. And we're hearing from people, particularly those in their 60s, who are like worried about the older people when they're actually in the risk category. We had somebody text us just yesterday and said, I truly feel that telling older people to stay home and isolate is society's way of getting rid of us. Many of our friends are in apartments where they're isolated but social. It took us years to get a home. I was hoping to have a life and not sitting alone forever because I'm over 60. She thinks that we're trying to trick her so that we can get rid of the old people. That's not our hearts. Truly, the risk... I got to show you the graph I sent my parents yesterday, as my brother and I have been trying to convince them to take this seriously, and I think they finally have. Mom, if you're here, you know it's true. Here's the graph in terms of death rate for coronavirus. Look at it from age 10 all the way to 50. There's basically like almost nothing happening. As soon as you hit 50, it jumps up. 60 jumps way up, and then way up here. You see this? Like, we have to take this seriously. I think the graph came. Could you see it okay?
I don't know.
We haven't gotten that far yet. So how are you convincing people in your life, older Americans, 60, let's just say 55 plus, to take this seriously? And I can give you some stuff about the Spanish flu in a minute that I think was really interesting, but we got to do that.
Deborah says funerals are for those who remain. You got to postpone it.
Yeah, amen.
Deborah says, interestingly, all volunteering should have been canceled. There was actually somebody that texted the show and said, I want to serve, but I'm in the group, and I finally just decided to just stay home. And she says she's very touched that people have actually come to her to try to serve her. That funeral one, that was one where Len's dad was at Friday and Saturday, and I was like, dude, it's a lot of people of that same age all together in one room.
I've got a friend my age whose father died, and they've postponed the funeral. Painful, but
yes,
necessary at this time.
Yeah. So how, when you postpone, I'm thinking of a way, but when you postpone the funeral, obviously the body won't be there?
Not necessarily.
Oh, you can
Depends on
still
what you
do
do.
it. Okay.
Cremation, you can wait as long as you want. My grandmother...
Oh, well, yeah, that, yeah.
And I don't know about the rest. I don't know how that works. But maybe I ought to... I want to share some of the Spanish flu stuff. You think I should share that again? I thought that was pretty
think so, yeah.
So check this out. Governor DeWine, if you're familiar and been watching the updates from him on a regular basis, keeps referencing a graph. And the graph has to do with the Spanish flu in 1918. And what happened in two different cities. I'm trying to find the graph so that you can see it. I've got it here. I don't know what I'm doing.
I'm sharing
Here's the graph.
the link right now.
Here's the graph. So the big pointed one, tall one, is Philadelphia, and the dotted one is St. Louis. And Governor DeWine, and I'm roughly quoting him here, said something along the lines of, no offense to my friends in Philadelphia, but I want to be like St. Louis in Ohio when it comes to deaths. So here's the basics of this, because he hasn't had time to expand on the history of it. In September 1918, Philadelphia held a planned Liberty Loan Parade to promote government bonds that were being issued to pay for World War I. That's how they did that back then. Buy government bonds, help us fight the war. The virus swept through the world, which would be the Spanish flu at the time, essentially H1N1. It swept through the world between 1918 and 1919. About a third of the entire world's population, about 500 million people at the time, were infected with the virus, and about 50 million died. That's according to the Centers for Disease Control and Prevention. At first, the virus was just in Spain, where 80% of the population was affected. The virus seemed far away. Remember, like 2 weeks ago?
Yeah.
Oh, those poor people in Wuhan, China. Oh, terrible. Anyway, what time is my favorite show on? No, that's something you would have said in the 90s. Let's binge watch Netflix. It didn't reach the U.S. until the spring of 1918, among military personnel, according to the CDC. Very specifically, it arrived in Philadelphia on September 19th, 1918. through the Philadelphia Naval Yard. In a matter of days, 600 sailors had the virus. And in spite of this, they had the parade anyway. Philadelphia didn't want to make people nervous or upset. They wanted their parade. So, ignoring warnings, they went forward with the parade, and 200,000 people got together and crammed together to watch the procession. 3 days later, hear this, 3 days later, every bed in Philadelphia's 31 hospitals was filled with sick and dying patients infected with the Spanish flu. By the end of the week, just the end of that week, more than 4,500 people, 4,500 people were dead. And it would claim as many as 100 million people worldwide, 50 to 100 million, somewhere around there. Different story in St. Louis. In St. Louis, just 900 miles away, within 2 days of detecting the very first case among their citizens, what did they do? And this is going to sound very familiar. Closed city schools, playgrounds, libraries, courtrooms, even churches. Work shifts were staggered. Streetcar ridership was limited. Public gatherings of no more than 20 people were banned. Sound familiar? The extreme measures known now as social distancing, which is being called for by global health agencies now, made a huge, huge difference. Startlingly huge difference. In fact, in St. Louis, less than half of the deaths Philadelphia saw took place. The per capita flu-related deaths were less than half of Philadelphia. That's why the governor keeps saying, you know, we want to be St. Louis, not Philadelphia. So how do we convince older Americans to take this seriously? It's not just the flu, it's not just whatever.
Kimberly says, I work in a doctor's office and we have a lot of healthy older patients just coming in for checkups and follow-ups. I feel like telling them, please stay home for your sake. Then Deborah's saying they're supposed to be postponing those appointments. I'm surprised they can even go in. Deborah, they are supposed to be postponing it. They're saying only go for like must do or like essential appointments. And in fact, even the dentist, which I'm surprised the doctors aren't doing this.
Yeah, tell me about your orthodontist.
Yeah, my son has braces on, and his appointment, which was set weeks ago, was on Tuesday. And they called me on Monday, and they said the dental board called all dentists and told them to cancel all appointments except for like urgent or emergencies. And so they canceled. And then she said, let's set for 6 weeks from now, and hopefully we won't have to do the same thing in 6 weeks. So they won't see him. So I was like, wow, he's like trapped in his braces.
And part of me wants to go to those of you who think this is just overblown. It's like, even the orthodontist is buying into this.
Yes. The dentist, because I saw a dentist on Facebook doing the same thing. The dental board or whatever told them cancel all appointments. And these kids are young, but they understand they can be carriers and get everybody sick. Robert said many older feel they are proving their faith by, in their minds, taking a stand. They believe by accepting these guidelines, they are giving up their independence, which is a fear for some as age.
I get that.
A great point.
I get that, Rob. You're right. And every time I've asked a faith leader, like today, Dr. Job, I asked the president of Moody about this very issue. And he said there's a big difference between faith and foolishness. He says you don't, for example, pray for a job and then wait for the phone to ring. You've got to do your part and take reasonable human action.
I think it's a lack of understanding, to be honest, because what I've seen a lot is we don't do this for the flu. And what are we just going to be just hiding from all these diseases? I think they don't understand why is COVID-19 different.
Because the death rate is dramatically higher.
Carl, go ahead. I'm sorry.
I just, like, it's not hard. So many people in that demographic even have dismissed news media, that they won't believe anything they say. And I'm just telling you, like, yes, it's biased. It's more biased than ever before. But that doesn't mean you can't find out information from reliable sources.
Carla says, my 91-year-old dad stays with us, so we keep him in. With his dementia, every time he sees something about coronavirus on TV, he yells at me to come and wants to know if I know about it. I'm planning to get him an old Western video to watch. I think people are starting to fully grasp the seriousness of it as they watch reports.
Yeah, I think finally we're seeing that. Janelle and I were able to turn the tide with our parents, separately, obviously. We look related, I know, but we're not.
I know, don't we look like brother and sister?
Right, exactly. And I think it finally worked yesterday. I'm not sure what it was, but
I think it's Sunday's, the weekend's developments were in particular in Ohio. Governor DeWine's announcements on Sunday. You don't think?
yeah,
Once
I think
they
it's part of
shut
it.
down restaurants and all that, I think people, because we got a lot of texts of older people saying, oh my goodness, now I'm taking it seriously today, which is after the weekend. Robert says, for your information, Social Security offices will remain closed to the public for 2 weeks. Appointment will be done over the phone only. This is a good time for family members to assist them if needed online. That's a great point.
And I like Deborah's comment, and I want to address that.
Problem is that we really don't know about this virus, so all precautions are being implemented. I'm torn and confused. Part of me says it's too hyped, but I don't want to be wrong, so go on the side of caution.
But here's the thing. We do know about the virus. We've watched Wuhan province in China and all of Italy turn into almost chaos as the virus just is going through the communities. And they're on now like individual isolation quarantine in Italy. It's really intense, and they're only 10 days ahead of us.
Look, dude, forget isolation. What they're doing with picking people that get masks, that's what our governor said. This is where we don't want to be.
Yeah.
He specifically said in Italy, it's the healthcare system so overwhelmed that they're literally having to pick. And it could be, we're protecting not just coronavirus patient, but also people that get strokes and people with heart attacks that are already needing resources. So in Italy, they have to pick between, like, does this person get the mask or this person? Somebody mentioned this is like World War, I don't know which one, and I don't understand like why that war. I guess they had to do that. Did they say it's like war, or was it like
No, it's like wartime medical triage in the midst of like a major disaster. You have to prioritize patients.
Yeah.
And you have to choose who gets to die.
And that's where we don't want to be.
But this is also, Deborah, why I wanted to share I shared portions of this article, because it feels hyped, right? Because I don't know anyone personally that has COVID-19. Do you know anyone?
No.
Doesn't change my opinion of this. Why? Because the reason we're taking these measures is because back in 1918, St. Louis did almost the exact same thing and prevented the dramatic influx of the Spanish flu. Philadelphia lost twice as many people as St. Louis because they took precautionary preventative measures. It's us doing this who are healthy as carriers of the virus to prevent other people from getting it. It's not too hyped. We need to take this seriously. It's one of those things where Janelle and I have been like pleading with our parents and others around us, please take this seriously.
Yeah.
No one's going to judge you. Anyway.
Elaine says, at least with flu, we have a vaccine to protect vulnerable people with. We have no vaccine for COVID-19. Aretha says, we must take this seriously. Why are employers having people go to work if they're just sitting around with not much to do? They're putting their employees at risk.
Yeah.
I don't understand that.
I don't either. I was grateful that my wife's company said, don't come in here. Do your work at home.
There are some major corporations that have hundreds of people in there. And I'm like, why is that even legal? Didn't we just say you can't have more than 10? I don't understand. And I know that how it can impact the economy. I understand that. But I'm assuming the quicker you get to it, the shorter it is, right? If we shut things down quickly, then I don't know. Deborah says, with a full-blown outbreak, there won't be the supplies and resources available. Right. Must prevent now. I'm a nurse. I'm all about preventing over treating.
Amen,
Ooh,
sister.
yeah.
Love it.
Yeah, I like that.
So do you think we finally convinced older Americans? I know there's fears, and we got pushback this morning from people.
Yeah, you still did. There was actually a guy that texted that was like, I don't understand. It's no different to the flu. The flu kills thousands of people every day, and why are y'all tripping? But
that's not true. I mean, it's true that people die from the flu, but it's also true that coronavirus is much more serious. If
you go by the mortality rate of 3%, and by number infected, according to the governor, then 3,000 would die in Ohio. In terms of, he was comparing the flu and COVID-19. I mean, yeah, there are still people that are not convinced. Are you okay?
No, I just get so frustrated by this.
Yeah.
And like Ron sent a meme we saw. It's very funny. Your grandfather went to war. You're being asked to sit on your couch. We can do this, guys.
Yeah.
Like, that's not that much that's being asked of us.
Well, yeah. Tamar says, yeah, everybody can't stay at home. We need to be mindful of their families and making sure their basic needs are met no matter what is decided.
That's
because
right.
Meredith is saying truck drivers are needed. Meredith also says retail people cannot work from home, though.
Right, which is why we have to be careful. We have to follow government expectations. I think we have to reach out to those who are in the higher risk categories and see if we can help them. This is the time to be the church. Oh my goodness, Kimasha Knight is here.
You better
All rise.
Straighten up.
You're not going to stand? I'm standing.
All right.
I'm standing, Kimasha. I don't know what she's doing.
Calm down.
Wow.
Tamar says, on a positive note, there are a few people who have made significant donations to cover the salaries of workers. That's the mindset we need to have.
That's right. Amen.
Meredith says, yesterday it just got to be too much. Our youth minister did a live worship time. It was so needed.
Yeah. Isn't that great? Those
Yeah.
are things churches can do for us.
Deborah says, keep minimal workforce working and find ways for others to work from home. We have to work in order to pay bills. Not many have emergency money, and if so, it will run out.
Kimasha is doing all that for me, Janelle, because you just sat there not caring.
Oh my God.
Kimasha, one of my favorite people. In case Janelle forgot, the Lord used Kimasha Knight to bring Janelle to the Lord. Apparently she forgot.
She's... What? Matt, what's up, Matt? Lisa says, my very active and healthy 90-year-old father will not stay home. He was out shopping at 4 stores yesterday, mainly to just get out. My mother's staying home. He says I'm fine. Very frustrating. I gave him a very stern talk yesterday.
This is what we're talking about.
What's frustrating, because I had a similar situation with my in-laws, and so my mother-in-law is concerned and taking it seriously and at home, and my father-in-law is like, oh, I'll be fine. I'll get out. The problem is you can go and infect the person who's doing what she's supposed to be doing. So it's a similar situation of like, oh, her mother is staying home, but it's still being put at risk.
And see, part of me a little understands the 65-year-old or the 60-year-old resisting. The 90-year-old? Stay home.
No, but can't you understand, though, the mental health concern about staying home and how depression can set in? And I don't know. I mean, I get it. Dude, people need to get out. I'm not agreeing. I'm just saying, don't you see that? They feel cramped up.
That's why I want to find out, how do we convince older Americans to take this seriously?
Or how can we make it... Do you think, like, if you need to get out, then I'll come and we could take a walk? No? Or they're not supposed to take walks? To just stay home? Like,
Well, okay, so that's the other part of it then. Is that we, as the people not in the high-risk categories, have to be sure they're cared for. Not just physically, but emotionally and socially,
Call
spiritually.
them. For example, we need to be intentional. We're not as busy anymore. So I'm calling out to Xers, young Xers, what's up? And Brian, and millennials, to like call our grandparents, nanas and papas, and FaceTime them so they don't feel as isolated. Take time to go and take them on walks. It's not that cold anymore, because it can provide alternatives. Theola says, not all old people don't understand. I'm 83. I decided to stay home on my own. Yeah. That's what I'm saying.
That's a great point.
We need to have her call.
It was actually, we should have her calling everybody.
Yeah.
A great Washington Post article that that supports what you're saying. Not all older Americans are doing this. You're right. There's many that are taking this seriously.
That is awesome.
There was a great point from Ira.
Ira says, a lot of people are in denial about this because they don't want to be inconvenienced. I heard a doctor on the radio said that their patients didn't see this epidemic as real because it's just a hoax. This is minor inconvenience. Folks deal with it in compassion and grace.
Right, yeah. I mean, my dad, this is where I want to go to him and go, Dad, in the early 1970s, you were drafted and had to move to Thailand for a year. I'm asking you to stay home. Please.
LaShonda says at 90, they have been through a lot of different trials and tribulations on this side of heaven. Could it be that they're just not as shook as we are? But is it that we're shook, or is it the science behind we need to stop the spread? It's not panic, like, oh, stay home or scared. It's let's prevent this from getting out of hand. It's the science behind it.
Yeah, because I just saw a great video my sister-in-law posted online. Somebody went to Italians because they're 10 days ahead of us. And they said, okay, talk to yourself 10 days ago. And they went through this long list of people on video that basically told themselves 10 days ago, you have no idea what you're talking about. Stop being so stubborn.
Wow.
This is serious.
Wow.
I don't want us to be in that position.
Yeah. Tamar says, amen. She's talking to LaShonda. I think that's the case. Many people are also just resilient.
Yeah, I think we ought to take it seriously. I don't think that we are. Yeah, I think it's important. And I don't know how else. We shared the article. All you have to do is look at what happened in St. Louis and in Philadelphia in 1918 with the outbreak of the Spanish flu. And then you can tell me, if we take some serious time studying that, which city you'd like to be in. If you're the person that wants to just say this is a big hoax and don't pay attention, you basically are going to move to Philadelphia and end up dead. Okay?
Yeah.
I know it's a little dramatic, but it's like,
it's true.
It's so common sense to me.
And you know what's crazy? Meredith says, I'm not so much worried about the virus as I am the people who are worried about the virus that will cause danger in public. Robert says, thank you, Brian, for being open to changing your mind.
Yeah, because Robert remembers last week, I was the exact opposite of the attitude I have right now.
Yeah, we were. Both of us.
Exact opposite.
Yeah. And recently I read something that was explaining it's more than the people that get sick with coronavirus. We're thinking about the people who are already in the healthcare system. Strokes, dealing with lung issues. We could put them in danger. That could be like your parents that are already dealing with stuff, and now the resources are taken away because now the healthcare system's overwhelmed. So I think it is about not panic, but love your neighbor.
All right, it's time for us to get out of here. Couple quick things for you. We set aside share for this week. We would have normally done overtime today because it's spring share, but we're postponing the major event. We're doing a cute little share, a little one. We're asking for your financial support. If you've been blessed by overtime, this thing happens because of gifts from people just like you. Would you consider giving? Just go to moodyradio.org/Cleveland. Janelle can post the link.
Yeah.
If I can get her to do something today. Just kidding. moodyradio.org/Cleveland. If you're here, you know how to use the computer, so you can do this. Ooh. If you prefer to do it by phone, it's 800-600-9624. 800-600-9624. We need your support. Lord willing, we can just do this little baby share, cute one, and cover most of the costs and not have to do a big one later. Okay? With that, join us tomorrow morning. My wife will be on the show starting at 6:30 tomorrow morning. Best show in a long time.
Oh, yeah.
She's a woman who knows what she's talking about. All right, guys. See ya.